Dr. Doreen 𝗔𝗓𝗄𝗃 is the
Dr. Doreen is an expert in autism.
Doreen 𝗔𝗓𝗄𝗃.
Dr. 𝗔𝗕𝗄𝗃.
Dr. Doreen 𝗔𝗓𝗄𝗃.
Dr. Doreen 𝗔𝗓𝗄𝗃 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. We've got a question that came in, and they're watching right now, so hopefully they can clarify too. They said, morning, 15-year-old on the spectrum, fully verbal, but has social anxiety, especially around new people or communication, question mark. He reads on a 5th grade level and spells on a 2nd grade level, and they said application for assistance in communicating for a fully verbal with social anxiety. So I think what you're asking, EFL, is, what can we do for somebody who's verbal but is having anxiety when communicating around people? I think that's what you're asking, and I hope I haven't misread that. But social anxiety is a very big issue right now, and I think it's a very big issue for a lot of people. Here I was at this conference this weekend, and I'm somebody who has social anxiety, and I'm not afraid to say it. And I was around a lot of people, and I haven't been around a lot of people very much since the pandemic. And every once in a while, I would say something like, I kind of get a little overwhelmed, and somebody would say, "Are you okay?" And I would say, "Yes, this is just very weird for me. I'm not used to being around this many people. And I don't have my mask on. I feel naked." And I thought to myself, I over-communicate. Let's be honest, I'm an over-communicator. But what is it like right now for a 15-year-old that already has a diagnosis of something that is, the communication is hard for them? It's got to, and you've been sort of in, like, you hit the pandemic like right around 11, 12. Like, this is a hard time for these young people.
Yeah, and 15 is a hard time anyway. For everyone. Like, it's just a rough age, right? Because our bodies are changing, friendships are weird at that age, there's all sorts of stuff happening. So there's a lot I can tell you about this, about social anxiety in general. One thing for sure, though, I think people need to realize, this is a complex one, but I'm going to attempt to summarize one aspect of, because anxiety is a really big deal, whether it's social anxiety or any other type of anxiety, generalized or whatever, separation or whatever it might be. It's a big deal, and it can make life very difficult for the individual who's experiencing it. And it's not just kids on the spectrum. There's like a large percentage of people suffer from anxiety of one type or another. Now, with social anxiety in particular, and I'm going to come back and talk about kind of just medication, because it's important, I think, that we have an understanding of that aspect of treatment. First of all, for anxiety, the two types of treatments that generally are the most effective and often go hand in hand to be even more effective are cognitive behavior therapy and medication. So we'll talk about medication in a moment, but cognitive behavior therapy and can be modified in some ways to be more just pure behavior therapy when it comes to individuals on the spectrum. But there are lots of different things you can do through this. So one is preparation. Preparation of any kind of social situation always helps. In fact, there's a lot of research that shows that people who have like very significant fear of public speaking, for instance, which is a big form of anxiety, don't and are completely capable of doing it if they're going to get up and talk about a topic that they're very, very practiced and familiar with. So familiarity and practice of any kind of social environment or role play is always going to help. So that's first of all. Secondly, when it comes to friendships and social and all that sort of stuff, our goal, like a lot of times as parents, we want our kids to we think, I'm going to put my child in a social situation and they're going to find friends. And that doesn't happen. In fact, they get more nervous, more anxious, more isolated because they might fail. So the best way to approach it is to actually bring one friend into their lives. And that can be done in a lot of different ways. It can be a neighbor, it can be a cousin, it can be one other person that they feel much more comfortable with, who's hopefully of the same age or close to the same age, a peer, and have them interact in the way that the individual now starts to establish a bond, a trusting relationship, feels a little bit more high self-esteem, feels a little bit more comfortable. And then they are able to the ideal scenario, which we always shoot for, is to find one other child from their classroom who they can bond with, because when they're back in the classroom now, they know a child, and it's almost like, here's a child who's going to stand up for them, who's going to be their buddy. Think about, even us, all of us, we act completely differently if we're alone versus with one other person, completely differently. In fact, like, you might be traveling with one other person, you'll go to restaurants, you'll go out and try things, you'll go to shopping, you go to places. If you're all alone, it is much less likely that you'll do those things. And that is also a form of social anxiety. So giving the child one other person is extremely helpful to them. Now, you can also give the child just other objects or things that might help the child feel more secure. As young children, we often have like a security blanket or something, right? Now, as we age, we give up those things, but we don't really. If you think about it, most of us wear, let's say, some sort of necklace, some sort of ring, some sort of whatever that gives us a sense of safety, or familiarity. And so with our kids, you can also give them an object, like something that makes them feel like, oh, this is something from home. This is something of my mom's. This is something that makes me feel, I'm just going to put it in my pocket. This is like a charm that shows that, God is watching over me, whatever it is that your belief system is. But objects of that nature that act in kind of a protective way, or the child believes, or the teenager believes, often are very, very helpful as well. Now, there's a lot of, as I said, and also just gradually acclimating the child to the individual, to school, all that sort of stuff. All of these things help with anxiety. But there's also practices like breathing exercises, meditation types of things that you can do, actually evoking the anxiety provoking situation, and then teaching the child how to breathe through it, how to find activities in the school environment, let's say, who they can go to talk to. If you're feeling anxious, you can also go to this part of the playground, you can go and do such and such, you can get a book from the library, like giving them solutions, tools. Those types of things are very, very helpful. Now, on the medication side, which I really want to just hit on because I think it's super important, a lot of parents they don't want to try anti-anxiety medications, which, by the way, are the same exact medication as antidepressants. Anxiety and depression are sort of dealt with the same way. And these are the neurotransmitters. These medications control our neurotransmitters, particularly serotonin, which we produce. And if serotonin is not absorbed enough in our brain, we tend to feel more anxious. So medications that are given to us are what's called selective serotonin reuptake inhibitors. So what they do is they allow us to absorb our own production of serotonin for a longer period of time. And so the brain receives more serotonin and then is calmer. The reason I'm talking about SSRIs, serotonin reuptake inhibitors, is that, you may be someone that thinks, I don't want to put my child on medication, but you have to realize that our environment, our food source, especially in the US, has become genetically modified to the level that we now don't receive anymore the nutrients that we need in order to produce enough serotonin and norepinephrine and dopamine and so on. So in some ways, our environment is producing this anxiety. A lot of the stuff that we do, the toxicity in our environment, the foods, etc. And so I am one of those people that feels I much more would like my kids to not experience anxiety. And I really don't think poorly of the SSRIs, SNRIs that also control norepinephrine. And I just feel that I've seen so many children lead happier lives when they're not experiencing that level of anxiety. And there's, you guys, all the way back to, honestly, I was a graduate student. So we're talking pre-1990, when I was looking for things that in those days they knew very little. We still know very little about what causes anxiety or causes autism. But when you were studying autism, even back then, a lot of research pointed to an imbalance in serotonin. And so I think it's really important that we help our kids with both medical and, as usual, cognitive behavioral or behavioral interventions together in order for them to not experience anxiety. Sorry, really long answer. I apologize.
No, thank you. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.